Hello everyone. I hope you guys are doing well. Welcome to the seventh episode of hashtag Being Healthy with Huda Shaikh. I am Huda Shaikh, a nutritionist, clinical dietitian, founder of a nutrition website named NutriBond, and your host for the evening. Before we move ahead, I'd like to wish all our viewers a very happy and prosperous Eid. I hope you guys are doing well and enjoying your day. So before I move ahead, I would like to take you through why we are doing this session. It's summers, and all of us are worried about our skin, our hair, and there are so many issues that we face each and every day. So, just to make sure that these issues don't trouble us during the summers, we have an amazing doctor with us. So, let's have Dr. Nishita Sheth in the frame.
Thank you, Huda, for inviting me over.
You're most welcome. Let's introduce Dr. Nishita Sheth. Dr. Nishita Sheth is a doctor and professionally qualified dermatologist, aesthetician, cosmetician, having vast experience. After M.B.B.S, Dr. Nishita did diploma in dermatology from Cardiff University and also completed her cosmetology training from Lillian Mount International School of Cosmetology, UK. She dons multiple hats, and today we would be discussing important things about health and skin with her. Welcome to the seventh episode of hashtag Being Healthy with Huda Shaikh, Dr. Nishita Shaikh. It's a pleasure to have you on the show.
Pleasure is all mine, dear. Thank you very much for inviting me over.
You're most welcome. So, Doctor, how has the lockdown been so far? How are you managing your work? Are you going to the clinic or you are working online like everybody else?
Okay, the lockdown has been, say, positive and negative both. See, I'm not going to the clinic anymore right now because my branch can always wait. We are into dermatology, so there are no emergencies in that. And so we are actually sitting at home and doing some online consultings and then doing my time pass with my art and my cooking and baking and all that.
That's amazing. So you're not heading to the clinic. You're not doing online consultations either.
I do the online consultings, but that's it.
Okay, okay. So you don't go out. So what challenges have you been facing as a doctor post the lockdown? Anything specific?
What did that question was?
What challenges have you been facing as a doctor post the lockdown?
Yeah. See, basically, even if we open the clinic, there are no patients coming in because of the fear of corona. So, and even my staff travels from all over Mumbai. I don't want to risk their life and risk our life also. So that's why we say, okay, let us just sit at home, let us also stay healthy and let them also be.
Absolutely, absolutely. So it's summer season. I'm sure most of the people are worried about their skin, worried about their health. So at this point in time, most of the people say that their skin tends to go oily and they have frequent breakouts on their skin. So what could be possible reasons and what can we do to reduce it?
Okay. So first of all, I will just give you some tips how to take care of your skin during the summertime. And they all will include the sunscreen and moisturizer and cleansing and scrubbing and all that. So first thing, you have to consider a change in your face wash. Basically, take a mint base or a camphor base which can work as a coolant to the skin. Lemon and tomatoes are the best ones. We have it in our kitchen.
Oh,
Second,
lovely.
include antioxidant in your facial skincare routine. So antioxidants also will help. Third, you can just keep your skin hydrated by drinking 8 to 10 bottles of water, glasses of water, and include lots of veggies and juices. Exfoliate your skin regularly. You can again exfoliate with kitchen things like basin haldi, aloe vera gel, and all that also. Then wear your sunscreen, at least SPF 30, 10 to 20 minutes before you step out of the house. And sun rays because the sun rays, they are not only going to tan your skin, but it also gives you're aging in the ring. And change a moisturizer from a heavy oil based moisturizer to a lotion base. Like we used all that Nivea and all in the winter, but when it comes to the summer, you need to have a lotion based sunblocks and moisturizers. Then wear your protection like umbrellas and hat and cotton gloves. Cotton clothing is the best one. Cut down on your makeup. So
Right.
makeup is like one thing which we all should cut down a lot.
Right. Right.
So these are the important skincare routine. Now, you asked about the breakout in the summer. So
Right.
in the summer, there are lots of sweat, and that is going to clog your pores. So clogging by clogging the pores, you get the breakouts more. So you
Right.
have to avoid stepping out of the house. Uh, that's it.
Right. So I hope the viewers are taking note. And if you guys have any questions, please feel free to put down your questions and we take up your questions during the show. So
You can
our
even
next,
use multani mitti for scrub. That is the best thing we can use for the
right,
scrub.
right. So that's Fuller's Earth, right, Doctor? If I'm not wrong.
Yes, yes, yes,
Yeah,
yes.
yeah. Okay. So, guys, please take note. And also, if you have any questions, please feel free to put your questions down during this session. So, what should be the skincare routine for people who have an oily skin, people who have a dry skin, and people who have a combination skin? Because usually, most of the times, we tend to mess up everything. We don't really know which face wash needs to be used. We don't really know what moisturizer, as you've already covered all of that. But if you could just, take us through
Sure.
what could be the routine for, even people who have a dry skin.
Okay. So when you are using scrub, dry skin needs a lot of aloe vera based, like with the basin haldi. You can do acne prone skin needs a multani mitti, chandan, rose water, etc. Moisturizer also you should choose. In the normal skin, you can use water based moisturizer. Then oily skin, you can use gel based moisturizer, and
Right,
dry skin you can use aloe vera base. Sunscreen again, if you have a very oily skin, you can get a gel based sunblocks too in the
right,
market. So
right,
your cleanser, your moisturizer, your sunblocks, everything needs a change with the season.
right. Very important because our viewers need to take note of this because most of the times what we do is we continuously follow the same routine. We use the same gel, we use the same face wash, we use the same moisturizer, same creams for our faces. So
Yeah.
make sure that there is a change as the seasons change. You need to even change your moisturizers and your face wash. Very,
Yeah,
very
also I
important.
would like to add in, you should also add on your fruits and vegetables and lots of juices, but the natural vegetable juices, not that sugary high calorie juices, because
Right.
they will again have an breakout.
Right, right, right. Very important. Diet plays a very, very important role in everything. Even if it is your skin health, hair health, it's very, very important. So, doctor,
Correct.
rightly pointed out that even if you want to have juices, you rather have vegetable juices or you have juices that don't have added sugars in them. So, most of the
Correct.
packaged varieties that we get have added sugars, have added preservatives. So, please avoid those. They are not good for your skin even though you might be consuming it thinking that it is good for your skin, but it's not good for your skin. As she said, it has loads of sugar in it. So, doctor, people are complaining about losing hair these days, and we've seen male pattern baldness, and we've seen that people, there's receding hairline these days, and it has become very, very common. So, what could be the possible reasons, and what can we do for it? I mean, do we have a treatment, or is there something special, a medicine?
So the hair loss is my favorite topic because we've been handling almost 80 to 100 hair transplants every month, and all over our clinic. We have 8 clinics in all over India. So hair loss is the main. My 70 to 80% practice is hair loss. Now,
Right,
hair loss in male is different and hair loss in female is different. Hair loss in male is due to mainly 90 to 95%. It's due to their own hormone
right,
killing their own hair root.
right,
So there is it's called androgenetic alopecia.
right,
Now it means the androgens, the hormones in the male, which is testosterone, gets
right,
converted into dihydrotestosterone. That has
right,
an affinity to start thinning, and first it will attack the anagen, catagen and telogen, all three stages of the hair.
right,
And then you if you see the hair loss patient, generally they start receding hairline and then they go bald like that.
right,
So
yeah,
reason is main one number one reason is androgenetic alopecia. Second one, right now in corona times, lots of hair fall because of the stress,
right,
tension. There
right,
are nutritional deficiencies. So in every patient of mine, after doing whether the hair treatment or the hair transplant, I'm on GST blockers and precautions.
right,
Are non-surgical and surgical, both the treatments available with us. So patient can choose according to their hair thinning and baldness and all that, and it works
right,
very good. Like, my patients are very happy. We almost tell them that a result with the hair transplant when we do, it changes their life, transform their life. Now,
right,
in females, when I talk about the female hair loss, the female in females we get stress induced. There are lots of hormonal imbalance, which also causes the hair loss in females. It's called polycystic ovarian disease.
right.
That's called PCOD.
PCO,
So,
yeah,
yeah.
PCOS or
So you
PCOD.
get lot of hair loss in that also. So you have to, and multivitamin deficiency. So we need to analyze as a doctor. You need to analyze what causes the hair loss and then treat accordingly.
Right, very true. So, doctor, I'd like to know something about PRP because I think most of the people have been hearing a lot about PRP, and I think this is again your favorite topic. So,
Correct,
I'd like to
correct,
know,
correct. More
I'd like
than
to
more
know,
than 10,000 patients we have for PRP. PRP
right,
is stands for platelet-rich plasma.
right,
Now, platelets, we have three things in our blood: red blood cells, white blood cells, and platelets. Platelets are the richest source of growth factors.
right,
So they have lots of growth factors. So when we extract those growth factors from the platelets and inject back into the scalp, that is going to work like a stem cell, or it will work as a thickening agent.
right,
So we have seen, but we do it with the derma roller, we do with the injectables, and then post PRP, we put patient on a low level diode lasers. So
right.
that will stimulate the hair growth, and the result is fantastic with the PRP and the laser and derma roller.
Right, amazing. Also, doctor, I'd like to know about scarring because a lot of people they suffer from acne, and post that they have blemishes on their skin, and there is scarring, and there are marks that are left
Pigmentation.
behind. Yeah.
yes,
So
yes.
what could be the treatment for it? Is there something that we can apply, or is there something any procedure that can be done to make sure to even out the skin tone or even out the marks that are there on the skin?
Sure, sure, sure. Again, my favorite topic. So, acne scarring, and pigmentation, which is also called melasma. That is a butterfly rash you get after the hormonal imbalance or after the delivery. You get a melasma in females generally. In male,
Right.
it can be due to sun overexposure of the sun. So you get now pigmentation can be treated with so many things. Again, they are also in kitchen. We have say milk, lactic acid, which comes from lactic acid peels. We do that comes from the extract of milk. Then
Right.
there are tomatoes. You can apply cucumbers. You can apply Dadima's nuskha was the best one with the
Yeah.
besan, haldi, and
Yeah.
milk or a curd. That was the best.
Right.
Then, if the pigmentation is not going with this home care uh, tips, you can go to the dermatologist and get the peeling done, chemical peeling.
Right.
So there are lot
Right.
many peelings which are very safe to do for the skin, because it's not like basically they will go into the epidermal and dermal layer and removes the pigmentation from inside out. Then after
Right.
that we put them onto the sunblock and the lightening agent topically to be applied, which is
Right.
available on the counter in the
Right.
medical stores.
Right. That's amazing. I mean, so much of knowledge. So, doctor, along with that, a lot of people have been complaining about graying of hair because we've been seeing that graying of hair has become, very common, and as children as small as 5 years old are suffering from graying of hair because I've seen like two, three kids in my building, and they have like gray hair right from the time they are 4 years, 5 years old. So, what could be the reason, and why do you think it has become so common?
Okay, the whitening of the hair or graying of the hair can be due to genetic mainly, and the second one also is it's linked with vitamin B12 deficiency.
Right,
So when you have a premature graying, again you can use this. There is a medicine called melatonin and all that available in the market that also helps, but it helps to a very small extent. So you
right.
need to first go, if it is very premature, then go to a
Hmm.
dermatologist, get your analysis done for the vitamin B12 deficiency, and then treat accordingly. But
Right,
then color is the only answer which I suggest to all my patients, that okay, we have to color, because there is no totally reversal of the graying, even if you treat it with the proper cause or proper whatever
right.
problem.
Right, right, very true. So, so doctor, there's no treatment typically, even if you start taking vitamin B12 supplements. So you're saying that it could be mostly due to genetics and vitamin B12 deficiency,
Correct.
right? So, also, doctor, what tips would you give to individuals who have an oily scalp? Because again, during the summers, you would see that a lot of patients would suffer from an oily scalp. Then it starts giving them acne on the
Dandruff
forehead.
and all that.
So,
Yeah, yeah, yeah.
yeah. So, what could be the reason, and what could they do? I mean, anything, any home remedies or any other medications that they can take?
See, oily scalp is called seborrhea. So there are lots of shampoos available in the market which can treat your oily scalp. But first of all, the home care treatments or home care tips are like, we tend to use very hot showers. Hot
Right,
shower can actually make your scalp very, very, very dry. So we should
right,
use lukewarm water, not hot water.
right,
Second, do not use conditioners in the summertime, because that
Right.
we like that conditioner effect because we get that
Right.
silky look of the hair.
Right.
But
Yeah.
then they are basically they are causing the damage more than the effect. Then
Right.
third, avoid going into the sun totally. If you have a seborrhea or a oily scalp, avoid
Right.
having lots of hot food. Means it's
Right.
again, if I have seen so many patients, they come in only when they eat, they get sweating
Right.
a
Right.
lot in the
Right.
scalp. So
Right.
avoid eating very hot food. So
Right.
and again, include your micronutrients, which you are expert giving all that advice. Include
Yeah.
your veggies and nutrients and micronutrients and multivitamins and juices and all that.
Right. Right. So, doctor, we have a question from Ankit Chaudhary, and he says, "How to know what skin type we have? How do we
Okay.
test it?"
Yeah, so normally the T zone, which is the this is called T zone. This is
Right.
always a combination skin. Then you get oily skin over here. So if you
Right.
wipe it with the tissue paper, you get to
Mm-hmm.
see any residue on the tissue paper. You can come to know that whether it is oily, dry, or a combination skin. But
Okay.
generally,
So,
this part is a combination skin, this part is a oily skin, and then this part is mostly the dry skin, tips of the nose, and this part, and all that is most of the time dry.
right. My next question was, how do you know whether your skin is a combination skin? But you answered it beautifully. So, also, doctor, what I see these days is a lot of people have pigmentations on their skin, and so what could be the reason for this pigmentation? I mean, I obviously know that due to age, people suffer from pigmentation.
Correct,
But then,
correct,
what could be the other reasons? I mean, in even in youngsters these days, I mean, as young as like 20 years and 25 years, even they have pigmentation on their skin. So,
correct, correct, correct.
what could be the reason of pigmentation?
Basically, the skin pigmentation caused by mainly by sun damage, then
Right.
inflammation or post acne. People with the darker skin tones are more prone to hyperpigmentation. It's
Oh,
due to
okay.
excess production by melanin. So,
Okay.
the answer to your question is just use sunblock, which is like more than 50 SPF. But in Goa clinic, we prescribe more than 50 SPF to 70 SPF. And basically, the ideal way or to apply the sunblock is to apply every 2 hours. But
Right.
we all don't do it, especially when you are in
Right.
the swimming pool. You should again apply it every hour or every 2 hours,
Right.
because that is like that is where you are going to be exposed more, and with the water your sunblock will go away, and so
Right.
you have to apply sunblock. Now coming back to the pigmentation at early age, so the pigmentation at early age can be due to hormonal imbalance,
Right.
due to post acne. So these are all treatable things, but you should always avoid going into the harsh sun, especially between 12 to 5. The sun
Right.
rays are very harsh. So
Absolutely.
avoid going out in that time. And even see when we are very, out of the sun, once we come into the office, we immediately exposed to the air conditioners. That
Right.
also makes you very dry. So,
Absolutely.
sunblock, hydrate yourself very well, 8 to 10 glasses of water. There are multiple medicines available on the counter, which is like, the Melalite, Melacare, and all that, but they have steroids. So, always use it after the prescription of the dermatologist only. So I
Right.
had a patient who was like, she has seen me once, and after I prescribed her for her melasma, I prescribed her Malacare. Then after that, she was disappeared, and after 6 months, she comes to my clinic. She loves her skin because all the pigmentation went away, and it was red. So I said, immediately stop this medicine, and it is only 4 to 6 weeks you are supposed to do it, but the patient
Right.
loves its skin and they just keep on applying that medicine forever.
Absolutely.
It gives you
Yeah.
thinning of the skin then.
Yeah. So, very good point raised by doctor is don't self supplement and don't start eating any medication just because you like it or just because somebody has told you. So usually डॉक्टर ये होता है ना कि बिल्डिंग में किसी ने बोल दिया अरे मैंने ये दवाई ली
बस
थी इससे मेरी
ये
स्किन अच्छी
हमारे
हो गई.
करेक्ट इंडिया में सबसे ज्यादा कॉमन है. इंडिया में
हाँ.
ओवर द काउंटर ड्रग्स, ओटीसी ड्रग्स आर मेनली लाइक चना ममरा के जैसे बिकता है.
Exactly, exactly. I mean, even as for that matter, if you see medicines like crocin and chest and cold and even antibiotics and even what do you say,
करेक्ट.
paracetamols, they are consumed as if like chana peanuts, pill poppers bolte hain
ट्रू
इनको
ट्रू.
ये बस they will continuously keep on having it because they get relief only from these medications. So very important
करेक्ट.
viewers, please make sure that you don't self supplement and you don't take any medication just because it has given a result to some other patient or other person, because one size does not fit all. And also, if you have any questions, we have 5 to 7 minutes. Please feel free to put down your questions, and we would love to take up your questions during the show. Also, doctor, I'd like to know what could be or what is the right treatment for psoriasis, because I've seen so many people in India suffer from it, and what could be possible reasons why we Indians suffer from it so frequently, especially
Yeah.
skin ailments.
Yeah, just see, psoriasis is the very excessive dry skin, basically. So, what happens is, again, we all, one doctor has given it to some patient, and everybody follows the same, and they will start using the
Absolutely.
same medicine, and all neighbors and everybody will start using without identifying it. Psoriasis
Right.
has to be confirmed by the biopsy, and then only should be treated. There are coal tar shampoos and coal tar creams and many things available. I am not an expert basically treating, because I'm only into clinical cosmetology, but then
Right.
I refer them to a proper clinical dermatologist, because
Right.
psoriasis is not a disease which is going to be cured. It's just
Right.
going to be controllable with the
Right.
medicines, and with the seasonal change it is going to flare
Right.
up. So
Right.
patient has to be on continuous treatment throughout the year.
Right. Okay. So it stays with you lifelong.
Yeah.
Oh, okay. So that's why I think, it can be controlled just like many other diseases or syndromes that we have. It can be controlled, but it might flare up during, the summer season or a
It can
specific
never
season.
be cured.
Yeah.
It can never be
Yeah.
cured.
So is it an autoimmune disorder? What is it? I mean,
Yes, yes, it
how
is an
it's an
autoimmune
autoimmune.
disorder.
Right.
And basically, in our skin, the skin cells are produced, and in psoriasis patient, the skin cells are produced in 10 to 20 times higher rates.
Oh,
So
oh.
they have that scales, white scales, because of the overproduction of the skin cells.
Absolutely, absolutely. This is one of the most beautiful sessions I've done because there's so much of information that's coming from her, and so very important for us to realize that these are some basic things that we forget. I mean, whether it's our skincare routine, whether it is the way we should be washing our face, we forget all these things. So we need someone like doctor to remind us that this is what you need to do. So, my next question would be, Doctor, what should a person do to have a clear skin and shiny hair? I mean, everybody wants it. Everybody.
Okay. Basic tips I've given you all. See, the skin and hair, both. You need to hydrate your skin very well, or you need to drink lot of water. drink lot of vegetable juices, include the micronutrients, include the multivitamins in your food, and your things. Then avoid going into the harsh sun, avoid having hot food, avoid having too much hot showers, and
Right.
cleansing, toning, and moisturizing, and sunblock. These are four things to get the best radiant looking skin. Skin
Absolutely.
types,
Absolutely.
according to skin types, you need to choose your product, and then do it accordingly.
Absolutely. Absolutely. So,
For
doctor,
hair
how do we
again,
come to know? Yeah, yeah. Please continue.
avoid chemical products like too much of perming and straightening and too much of hot irons and all that. We should avoid, because then you will have a rough and dry and brittle hair.
Absolutely, absolutely. Please take note, people, because we feel that coloring our hair 10 different, with 10 different colors is in. It's the trend, so we should just do it. But make sure that it's not damaging your hair, because one size does not fit all, and it's not good. If you're not taking precautions post coloring your hair, then your hair is actually going to go bad. So please make sure that you don't use too much of chemicals on your skin and on your hair. Am I right, doctor?
Yes, yes, perfect.
Yeah, yeah. So we have a question from Praveen Jain, and he asks, is it true that psoriasis is due to food allergy? I think she's already answered this question, but we'll do it for you.
Yeah, psoriasis can be due to many agents. It cannot be mainly food, can be one of the reason, but
Right,
it's basically there are multiple reason. Again, that is why psoriasis should never be treated at home. You need
right,
to consult a good dermatologist, and then only you can get treated or you can get controlled. You should
right,
never sit at home with the psoriasis. And in
right.
psoriasis, just 1 to 2 tips I will give you is, again, don't use the hot water on psoriasis skin. Second,
Right.
immediately when you come out of the bathroom, when your skin is little wet, you apply a good moisturizer or a good oil onto all over your body, which will help in psoriasis a little bit.
Right, right. So I hope we've been able to answer your question, Mr. Praveen. And if our viewers have any more questions, please feel free to put down your questions. We'll take up the questions during the show. Also, doctor, you were talking about SPF, and you said that most of the patients are suggested an SPF that is above 50 or 70. Why is that so? I mean, because most of the dermats or most of the doctors say that anywhere between 30, 35, 50 should be fine.
So see, I tell you, when you're in uh, when you have 30 SPF is also good, but when you're in
Hmm.
Goa and you're exposed to sun a lot, and the
Right,
tropical regions where you have to apply more than 50 SPF, but
right.
otherwise in other places you can even apply more than 30 SPF. 30 SPF
Okay.
is minimum,
Right,
because
right,
otherwise it is no use if you're using 10 to 15 SPF. It's just like
right.
your makeup. It is going to be just
Absolutely.
like a makeup, and it's not
Right,
going to do any good to your skin. So
absolutely.
always use more than 30 SPF.
Right. So I think I hope viewers you are taking note of this, and this is a very very important point, and doctor has been emphasizing on it, and she's been saying that it's extremely important to apply a sunblock or to apply a moisturizer that has an SPF beyond 30, 35, and 50, 70, as she's saying, because if you are in any tropical country, or if you happen to go to a country that has a temperature more than 40 degrees, so it can actually damage your skin. So make sure that you are using a sunblock.
Yeah, one more thing. See, basically, we have in our mind, when the rainy days are there or clouds are there, then we stop applying sunblock on our own. Sun rays can,
Right.
UVA rays can pass through the clouds and affects our skin. So you should
Right.
apply sunblock all around the year, not
Right.
only in the winter or a summer, but you have to
Right.
apply even in the monsoon time.
Right, right. So I was coming to this, doctor, that during the monsoons, again, the skin is, it's because the climate is very humid. The skin tends to go oily, and also, what kind of routine should we follow? One more thing
Okay.
is that we lose a lot of hair during the monsoons. So why is
Correct.
that so?
Okay, so we love monsoon as it is. It brings lots of greenery, happiness, and cooling breeze, but also brings high humidity. So,
Yeah,
because of the high humidity, which takes a toll on our skin health, especially for oily and acne-prone skin, because then
yeah,
you will sweat a lot and it will start clogging your pores. So you have to
absolutely.
use, again, in monsoon skincare is totally different. So
Hmm.
rainy or cloudy day doesn't mean your skin is safe from the harmful UV rays of the
Absolutely.
sun. So use your sunscreen well. Make sure you wash your face 2 to 3 times a day to avoid excess oil and dirt, further avoiding fungal infections. Then drink
Right.
lots of water to keep your body hydrated. Try not to wear a makeup which can clog the pores again. Then
Yeah.
avoid going into between 12 to 5 again. Avoid going into the sun. Monsoon is the season to have a, nice hot fried food. We all tempt
Yeah.
with the samosas and bhajiyas and all that,
Pakoras
but
and
we
all
should
that.
avoid it. Yes, because it'll again make your skin dull and dry.
Very true.
Some of the best exfoliants in the kitchen are papaya, coffee, tea bags, oatmeal, yogurt. All these are mild exfoliants, so you can use them regularly
Right.
without
Right.
any side effects. Once
Right.
exfoliated, cleanse the open pores and allow your skin to breathe. Then
Absolutely.
you can use a mild like coconut oil or olive oil, something like that, to clean your skin. Toning in monsoon. So tone your skin to remove the leftover dirt and makeup from your kitchen. Again, natural toners are green tea, lemon juice, tomato juice, cucumber water, or rose water.
Right.
Moisturizing in monsoon to keep your skin hydrated and soft. Again, from the kitchen, you can use olive oil and cucumber and organic coconut oil and all that. Yeah. So these are all about the monsoon skincare tips. And again, in for hair, avoid having hot showers. Um, Now, in monsoon, the basic problem is going to be a fungal infection. So you
Right.
get lots of fungal infection cases in during the monsoon because of the humidity. So the
Right.
bacteria grows and fungus grows during the monsoon season. So you have to avoid, going into the rain,
Right.
which should, we should enjoy also,
Absolutely.
but then take care of that.
Yeah. Yeah. We have another question from Praveen Jain, and he is asking: is it true sunscreen lotions can cause cancer? I'll just continue his question because I read somewhere it blocks fluid to come out of the pores of the skin. So, what would you say on this?
What is that question again?
He's saying, is
I
it
didn't get
true
it.
sunscreen lotion can cause cancer? Sunscreen lotions can cause cancer. That's what he's asking, and
No, no.
because he's read it somewhere.
Okay, no, it's not true. Sunscreen basically, in if you see European patients, they have to use a sunblock, but then they overuse it. So
Right.
when you overuse it, they may give you, see, overusing of anything in excess is not good for your skin. Even
Absolutely.
water in excess is not good for your skin. So you should not do. And people in Europe and US people, they go into the sun tanning. There
Right.
they use the sunblock every
Right.
half an hour or every hour, and that is going to cause a lot of problems. It's not
Right.
directly related to the skin cancer, but it
Right.
can, if you're using too much of sunblock every half an hour to 1 hour. Because I've seen on in Goa, I see all the foreigners, they are only in the beach, they just go
Right.
lie down on the beach, back pay, and then just applying. And I see only one thing with them is the sunblock in their hand and the
Yeah.
one water bottle. That's it.
Right.
And they will just, if you notice them, every half an hour to 1 hour, they will keep applying the sunblock. So overuse of, because sunblock obviously has some chemicals in it. So
Absolutely.
overuse of chemicals can lead to some side effects.
Right. Also, one question, doctor, that is it safe to wash your hair every day? I mean, usually people have a question that whether we can wash our hair every day, whether we should wash it every alternate day, or
Yeah,
most usually we were told that अरे 2 दिन में एक बार सर धोना है नहीं तो ना सारे बाल निकल जाएंगे shampoo से. So, what is the
सही
truth
बात.
behind it? And yeah, what is the truth behind it? Or should we wash it every day or every alternate day is also fine?
Basically, correct. Basically, male, they have a habit of having everyday hair wash. Okay?
Right.
But one should avoid using the harsh chemicals. That is, shampooing every day is not needed. So if you
Right.
want to have a hair wash every day, you do it. But then avoid having the harsher and the stronger shampoos. And don't
Absolutely.
condition your hair every day. That's only going to increase your hair fall. So in females, I generally tell them thrice a week you should wash your hair, unless until it is like very oily scalp. So even
Right.
if they have a oily scalp, they tend to wash it every day. But then
Yeah.
I tell them specifically that don't use the shampoo every day.
Absolutely. Absolutely. So very important, viewers. If even if you want to wash your hair, make sure you wash it with normal water, but don't apply shampoos that have heavy chemicals. You can use mild shampoos. Is that okay, doctor?
Yes, yes, yes. Mine
Yeah.
shampoo. My favorite shampoo is Johnson baby shampoo. So I give it to all my hair transplant patient, all my hair patient. They only use Johnson baby shampoo. And after 6 months, they'll come to me. They'll say, "Doctor, abhi bhi use karna hai?" I said, if you like it, you can use it
You can
forever.
continue.
But
Yeah.
after 6 months, I switch them over to the normal shampoos. But for 6 months, I put them onto Johnson baby shampoo also,
Right. Right. Amazing.
because they
So,
have
doctor,
less
I think
chemicals basically.
yeah. Yeah. So I think you've beautifully answered all the questions. I just have one last question for you before we end the
Sure.
show. Any piece of advice that you would like to give our viewers with regards to skin and hair health?
Skin and hair health. I have given you so many tips about it. Drink lot of water. Eat all the micronutrients, vegetables, juices, and all that. Include all that into your food routinely. Avoid going into the sun. Get your skin cleansing, moisturizing, toning, and scrubbing. Scrubbing also, once or twice a week. If you scrub it,
Yeah,
you are actually removing the dead skin cells,
right,
and because of that, you are doing the anti-aging to your skin.
right. So again, doctor, over scrubbing is not a good option if I have heard it right. Usually people scrub their skin every day with hard
That's
scrubs.
why I said. That is why I
Yeah,
said only once or twice a week. People use it
yeah,
every day. It is going to make their skin dry, and
absolutely.
it is going
And
to
it's going
make
to
their
give you
skin
problems.
thin.
Yeah, very true. So, doctor, thank you so, so much for answering all our questions patiently, for listening to everything that we had to say, for answering the questions of our viewers and detailing it out for us so beautifully. Thank you so so much.
It's my honor to be with Huda Sheikh. Every time she tells me, "Doctor, are you there?" I said, "Yes, I'm there for you." Every time,
How
anytime, every
beautiful.
time, I'll be there with you. Okay.
Oh, how nice. Thank you so much. I think,
Very much
it's
for
Eid today.
inviting me over. Thank you
Yeah.
so very much for inviting me over, dear.
Thank you so, so much, Doctor, for, the wonderful words, for the kind words. And yeah, next time I do something else, I'll definitely call you back.
Sure.
Thank you so
Thank
much, Doctor.
you.
It was amazing to have you on the show. Thank you so much.
Thank you.
So if you have any more questions, you can feel free to put down your questions and we'll try to get you answers to those questions. You can also follow Dr. Nishita Sheth on Instagram. She is on Instagram as TNCC. So you can, just search for her and you can put down your questions or DM her your questions if you have any. Similarly, you can follow me on Instagram. My Instagram handle is NutriBond by Huda Sheikh. You can also follow my Facebook page, that's NutriBond. So till then, stay healthy, stay safe, and our show is powered by Kotak Mahindra Bank.